So basically, the long story short is nobody actually needs a lift. Everybody can have an explant without a lift. It's their prerogative. I totally understand waiting, evaluating your skin, seeing if it will tighten over time. And I did several hundred that way before I started doing any lift procedures back when I started doing this in 2016. So we can do it in whatever manner the patient wants in order to help them get where they want to be at the end. I always will try to come up with ways to limit scarring, but that being said, there's the circular or the donut lift. There is basically a lollipop lift, and those are predominantly how we will help patients with skin tightening that is surgical. I don't do an anchor and I don't do a crescent. An anchor to me is something that's going to box out the bottom of the breast, so I don't prefer it. Especially if you're going to go back and fat transfer up against that, I think it's much harder. I have lots of little adjustments that can be made afterwards if there's no lift or circular lift or a lollipop lift that would not work when there was an anchor. So I focus on those to help our clients get the best possible, outcomes and the littlest amount of time or surgical steps as possible. So in summary, not every breast explant surgery patient needs a lift. They have to come with, their questions, and I try to give them the best possible information that they ultimately want to have a lift or don't want to have a lift. It's their choice.